data demonstrates that HIV and COVID infections are exacerbated by racism and heterosexism. While we acknowledge that other diseases are negatively impacted by systemic forms of oppression, HIV and COVID have similar stigma and disproportionately impact the same patient populations. For this reason, we propose the two-in-one model that advocates for routinizing HIV, PrEP, PEP, and COVID vaccine screenings. The primary care setting is a powerful place to prevent both HIV and COVID. For both viruses, patients have reported being uncomfortable talking about their exposure and disease status. When it comes to HIV, there are taboos connected to sex and injection drug use, rather than the fluids that transmit it. For example, the 1981 naming of HIV as GRID, or gay-related immunodeficiency disease, explains why some people have a low risk perception if they don't identify as gay. While for COVID, stigma related to masking, quarantining, and getting vaccinated also exists. Let's now hear from Dr. Howard Straker to tell us a little bit more about COVID vaccinations.
COVID vaccination rates have lagged due to the historic and systemic barriers patients face across the social determinants of health. But it is also well documented how bias leads to patients feeling dismissed or profiled in clinical encounters. Routinizing screening questions for HIV, PrEP, PEP, and for COVID vaccines would help prevent patients from feeling targeted or judged by the questions. As a primary care clinician, we have a role to play in this work.
Please join our CME Bearing 2-in-1 training to learn more about routinizing these screenings while removing harmful stigma causing disproportionate HIV and COVID outcomes for racial, ethnic, sexual, and gender minoritized patients. Visit twoinone.smhs.gwu.edu to learn more.